Hello, Jenny.
Hi, Jahahi.
So today we're going to talk about Minority Mental Health Month that happens in July. But before we get started, my name is Jahahi Mazariego. I am a clinical social work intern here at Community Health Alliance, and I work with anyone who is needing to talk to a behavioral health professional. And then my cultural background is I am a Salvadorian American. I'm the first in my family to live in the United States, the first in my family to go to school, and also the first in my family to openly talk about mental health. And so I'm very excited to talk about this topic with you, Jenny.
Yeah, so my name is Jenny Ayala. I'm a licensed clinical social worker here at Community Health Alliance. I work as a behavioral health provider for the pediatric unit. So children and youth is who I focus on. My cultural background is Mexican. In Jahi, we have so many things in common. I'm also first generation everything, and the first in my family to seek mental health services and work in mental health.
Yes, so when we're talking about Minority Mental Health Month, it is a topic that Jenny and I really enjoy talking about. But how do we define Minority Mental Health Month?
Yeah.
So essentially, Minority Mental Health Month occurs every July, and it really is just to raise awareness about the mental health experiences within the Black, Indigenous, people of color communities, and others who experience inequities due to systemic barriers, and those who have experienced oppression within these systems and seeking support, mental health support in other areas like education, etc. Um, but who do we define as more minority? As I mentioned before, is generally people with racially and culturally diverse backgrounds, individuals who are Latino, Asian, Black, Indigenous, and so on. But it's also important to know that most people don't carry just one identity, right? For
Mhm.
example, myself, I am a Latina and I'm Salvadorian American, but I am also a woman too. So I go into this world with those two identities and much more too.
Yeah, Jahahi. And then we throw in other identities, right? We can throw in gender expression and sexuality, and those bring up other intersections for us. I think one really cool thing about CHA is that we have so much diversity here. We walk around the world as the minority, but at CHA, we feel like the majority.
Absolutely. And so with that knowledge and that opportunity to work with such a diverse background, individuals with diverse backgrounds, we have the ability to really normalize and say that your identities are valid and your experiences because of those identities are real. And so but it could be really challenging. I think
Mhm.
oftentimes people who are seeking mental health support think it like it's a negative thing, and
Mhm.
that's what I wanted to talk about with you today is the mental health stigmas that we see
Yeah.
within our own communities. So to define what mental health stigma is a negative belief for when people are seeking mental health support. And so I'm not sure, Jenny, if you could share one example that you see people struggle with when seeking support.
Yeah, so I think the very common one is if you're seeking support, you're crazy, right? People only see therapists when they're crazy. Another one for women and girls is if they experience a lot of emotions, they're drama queens, right? And they're just exaggerating the story, and we should just get over it. And I'm sure you've heard some of these as well.
Oh, absolutely. And then I see it on individuals who are males and who are Latinos, particularly, that they are often told growing up that any other emotions but happy or content, like you're angry or like crying, that you need to toughen up and then you need to brush it
Mhm.
off and continue. But it's really hard when there's something really major sitting on your chest and your emotions, and so, it's not easy as brushing it off, right? If we brush it off, you and I wouldn't be here in
Yeah,
providing
I think,
mental health
and
support.
another common one, right, which is so funny to me because we are now therapists, is, why are you talking to people that you don't know, to strangers about your problems? And you and I both know, like, we're not strangers for long?
Absolutely. And even though we share some of the similar identities as our clients, we have a unique opportunity to really understand just the issues that come around those having those
Yeah.
diverse racial and cultural identities. And so some of the common mental health concerns that we see within our communities are issues relating to anxiety and depression. And sure, anxiety and depression can be individual or biological, but it's also important to know that our environment and our support can also impact the way that we see ourselves in this world. For an example, during the social awareness and uprising last summer, we saw Black, Indigenous people of color face more anxiety and depression because they saw those videos online, and they're really feeling much more difficulty accessing services during the pandemic. And then Jenny, I'm not sure if you've also seen individuals with different immigration status also face unique barriers too.
Yeah, definitely. So I noticed that immigrants, children of immigrants, a really common fear and common anxiety is family separation, and a lot of them have already gone through it and fear it happening again, so that's a huge, huge one. And I think another concern that is individual to people who don't speak English is that we have such a need for bilingual therapists. So many of us cannot find therapists that speak our language or that even match and understand our culture.
Absolutely. And so how do we combat these stigmas within our homes or within our own communities? Now, one could be we can openly talk about our feelings to our family and also friends, although that might be a bit challenging because if you're the only one openly talking about it, it can be really hard to feel as if you're part of this, we're part of this community, right?
Yeah.
But what other ways can people do to challenge the stigma about mental health?
Yeah, I think for me, because I work with children, really teaching families that, some of these mental health issues run in the family, right? So if I'm seeing the child, I ask the parents, have you ever gone through this? Have your parents ever gone through this? Are there children in the home or aunts and uncles? Because we view mental health so differently from physical health, but it's actually the same thing. So starting at home, having those open conversations about how we feel and when we need help.
Absolutely. You make a really good point that, we think about mental health as being just emotional, just being emotions, right? But we got to feel it physically too. And so really it's seeking support and know that you may feel alone when asking for mental health support, but you are not the only one who's needing it. And so this is why we have multiple behavioral health providers here at Community Health Alliance. Me and Jenny are just two of many. So we also are able to provide services in Spanish if anyone who does need it. So don't hesitate to reach out to us or ask your medical provider to talk to one of the behavioral health providers here at Community Health Alliance. But thank you so much, Jenny, for helping me bring awareness about this very special month.
Yeah, thank you.
All right.